Heather, go see you. Go ahead.
Thank you so much. Thank you everyone for being here today, for joining us. My name is Heather McPherson. I am the NDP Member of Parliament for Edmonton Strathcona. And we're here today because the global pandemic has brought to light much welcome scrutiny, a great many issues that have plagued us as a society. But perhaps the most graphic and horrific of these is the condition of our seniors living in long-term care facilities. Today, more than 25,000 Canadians have died from COVID-19, and of that number, nearly 18,000 were seniors living in long-term care. The reporting is incomplete, but at least 60 long-term care workers, support staff, and family members have also died from COVID-19, making long-term care the most dangerous profession during this pandemic, more dangerous than working in healthcare facilities, meatpacking, the oil sands, or driving a taxi. The loss is incredible. Tens of thousands of seniors and care workers have suffered. Thousands have died needlessly because this didn't need to happen. It happened because we as a nation have ignored the long-term care needs of our seniors, and we've allowed profit to drive our system instead of care. It's time to take the profit out of care and create a long-term system that works for Canadians. When the military was called in to help with the crisis in long-term care facilities in Ontario and Quebec during the first wave of the pandemic, soldiers who've been trained for combat, suffered PTSD from what they witnessed. The Canadian Armed Forces reported the military intervention in Ontario shocked Canadians. It detailed horrific conditions. Non-ambulatory seniors abandoned, left to die in their own soiled beds alone. COVID patients housed in the same rooms with not yet infected residents. Rotting food, residents who had suffered waiting for food and water, residents found dead from dehydration, and too few care workers with inadequate support and inadequate PPE. Politicians, including the Prime Minister, expressed shock at the report, but no one should have been shocked by this report. Long-term care workers and the families of residents in long-term care have been trying to tell us about the crisis in long-term care for a very long time. They have tried to tell us about the inverse relationship between profit and care. They've tried to explain that inadequate working conditions lead to deficient care. But our government has not listened. Instead of getting the profit out of long-term care, the federal government is investing in it. Revera Inc. is one of the largest for-profit companies in the long-term care industry, with 500 facilities in Canada and around the world. It's owned by a Crown corporation, the Public Sector Pension Investment Board. Prior to the pandemic, Revera was facing 85 lawsuits from Canadian families for neglect leading to death. During the pandemic, Revera has been responsible for some of the largest COVID-19 outbreaks and the highest death tolls in Canada. Right here in my riding of Edmonton Strathcona, a Revera facility, South Terrace Continuing Care, recorded one of the largest outbreaks of COVID-19 in Alberta, with more than 200 residents and care workers becoming infected. 30 people died. 30 people in Edmonton Strathcona in a for-profit facility owned by a Crown corporation, a company famous for problems with and for its profits. And now the government of Alberta is proposing legislation to shield these companies from lawsuits related to their care. Our governments are failing us. Let's be clear. The pandemic did not create the issues in our long-term care system. These issues have been with us for a long time. COVID did not fail to invest in public care. COVID didn't build a for-profit system that undermines care. And COVID did not create chronic understaffing in order to drive profits. COVID merely exposed these issues that have been festering for decades, issues that residents, their families, and long-term care workers have been telling us about for decades. Today, we will get a snapshot of these issues, as seen in Alberta just prior to the pandemic, and it should be a wake-up call. It's time to bring our long-term care system into our healthcare system where it belongs. It's time to invest in public long-term care. It's time to get profit out of care. And it's time for national long-term care standards that protect our seniors and the workers who care for them. Thank you very much. I'm going to pass the mic now to my leader, to Jagmeet Singh, who has been an incredible champion on this file, standing up for seniors across the country. Jagmeet?
Thanks so much, Heather. And thank you for that opening. That opening is really powerful and really summarizes what we're here to talk about. When we look at this pandemic and we know how much it's impacted so many Canadians, how much it's hurt families, people have lost their jobs, small businesses have been forced to shut down, and people have lost their life. As Heather was saying, what is a national shame is how seniors, particularly those in long-term care, bore the brunt of this pandemic. That is a national shame. And what we'll hear from today is that this was avoidable. The problems in long-term care have been there for a long time. They are long-standing, existing problems that were exposed by the pandemic, and we can fix them. But the key problem that we've identified, that experts have identified, is that when profit is the motive, it means seniors do not get the quality care they need. So we are calling again to remove profit from long-term care. We don't want the crisis in long-term care to be ignored just because we are doing better with vaccination. And at the end of this pandemic, if we haven't used the momentum we have now to fix once and for all the crisis in long-term care and ensure that our loved ones, the ones who are most vulnerable, are cared for with respect and dignity, then we have failed. We need to fix the problem. So again, we are calling for a removal of all profit from long-term care. There should be no profit in healthcare, period. But certainly when it comes to the treatment of vulnerable seniors, they should come first. Their care should come first. It shouldn't be about the bottom line. It shouldn't be about profit. It should be about their care. And with that, I want to introduce two speakers that will be speaking today, June St. Louis and Rebecca Graff McRae. Rebecca is going to share some of her findings from as from a member of Parkland Institute. She's going to share her findings in terms of what we've learned from long-term care. And one of the key findings is more staffing, national standards around making sure we've got great levels of staffing can directly improve conditions of care and will directly save lives. Donc, je veux dire que c'est un moment maintenant pour nous de reconnaître que pendant cette pandémie, c'était nos aînés qui étaient les plus frappés. Et c'était une honte nationale le fait qu'on a perdu assez nombre de nos aînés. Et le fait qu'on a eu l'occasion de prévenir tout ça si on a décidé d'améliorer les conditions de soins dans nos centres de soins de longue durée. Donc, ce qui s'est passé, c'est une honte. On doit le régler. Notre demande, c'est d'enlever les profits dans notre centre de soins de longue durée. On a aujourd'hui deux personnes qui vont donner leur expérience, June St. Louis aussi et Rebecca Graff McRae. Rebecca va expliquer comment ce qu'elle a appris pendant ces pandémies, comment l'importance des soins et les numéros des heures de soins et aussi le montant des gens qui donnent des soins sont importants. Donc, with that, I want to pass the mic to Rebecca. Thank you, first of all, for the work you've done. And again, we have an opportunity here to fix a problem. Rebecca has outlined in a report some of the key findings of what we need to do to make sure seniors are cared for. Rebecca, the mic is yours.
Thank you so very much, Jagmeet and Heather, for really setting out the context in which we've released our new report. It's called Time to Care, and it is available for anyone to read on the Parkland Institute website to look into more detail at some of the findings that I'm going to outline for you here today. And as you both mentioned, the problems with long-term care across the country have long been known. And we have seen for more than 2 decades, workers and advocates and families trying to raise the alarm, particularly around the pressures on staffing. And as you've both outlined, we've seen how those pressures increased exponentially under these pandemic conditions. So our research was a survey of long-term care workers in Alberta, which was conducted just prior to the outbreak of COVID-19 between November 2019 and the very beginning of March 2020. And it sought to substantiate these concerns and to give voice to the experiences of frontline long-term care workers, to see how staffing levels and working conditions impacted them directly and their ability to provide care. And our findings unequivocally affirm that long-term care staff have too few hands and rarely enough time to provide the care our seniors need and deserve. So what we found was that 90% of respondents reported that their facility worked short-staffed, at least occasionally. 44% indicated that short staffing was a daily or weekly reality in their facility. 75% consistently had necessary tasks left undone at the end of their shift. And by necessary tasks, that includes essential care tasks, such as answering call lights, turning residents to prevent pressure ulcers, providing assistance with meals and toileting. It also included deep cleaning, updating important information in resident charts, and most sort of heartbreakingly, simply talking with residents, socializing with them, helping to provide companionship. And 70% of our respondents reported that they would often stay late beyond the end of their shift and very frequently unpaid in order to ensure that those tasks got done. So often the long-term care workers we surveyed reported working through their breaks. They mentioned being unable to take vacation time or sick leave because there was simply no one available to cover their shift. 41% of our respondents reported that the ratio of staff to residents in their facility is seldom or never adequate to meet residents' care needs. 41%. And there was a really strong correlation that we found between the profit status of the facility and that adequacy of the staffing ratio. When asked whether their facility had adequate staffing to provide quality care for residents, a significant disparity could be seen across those ownership or profit categories. 34% of respondents based in for-profit facilities reported that they never have adequate staff to resident ratios to meet the needs of their residents, compared to just 7% within publicly owned facilities. Not-for-profit facilities, run often by charitable or faith-based organizations, fell in the middle at about 16%. So these were the conditions in Alberta's long-term care prior to March 2020. And what we know is that those conditions only became more difficult for workers and for the residents in their care.
Thank you so much, Rebecca. Really appreciate your comments and the work that you've done to highlight what was the situation before the pandemic. And of course, things only got worse with the pandemic. It bolsters our argument that this has been a longstanding problem and that profit is certainly a big part of the problem. I want now to ask June to provide her experience. This is someone who works on the front lines, and we'll talk about what it means to give some of the reality, the real world experience of what Rebecca has talked about, the evidence that she's gained. June, please provide your story. Thank you so much, June. The mic's yours.
Thank you. And thank you, Rebecca. Your report captured everything that's happening in long-term care. I'm also a local chair, which means that I have contact with lots of members throughout Alberta, both public and private. So I have lots of information. Because I have 2 to 3 minutes, I have to be brief and give a brief overview. Who better to speak on an issue than someone who has been on the front line? With over 25 years of service in long-term care environment, I've seen many scenarios played out, of which is a domino effect of insufficient staffing. This issue not only affects workers, but residents as well. Some would say there are no magical solutions to staffing and workload issues. But I say if we can place emphasis on human decency and dignity, we can make ethical decisions to put our elderly as priority over profits. Short staffing was always an issue, even before the arrival of COVID 19. COVID 19 only exaggerated the problem. Let's fast forward to 30 years from now, or pretend you're in a long term care. What kind of care would you hope to be receiving? Imagine sitting in a dirty product for hours or without being repositioning. Imagine being washed too fast to be washed well. Imagine sitting and looking at your food, getting cold and hungry. And if no one feeds you because they're too busy doing somebody else, you're not fed for hours. Wouldn't you have preferred to have staff who are refreshed, rested, relaxed, not overworked, tired, stressed, burnout to attend to your needs? Would you have preferred to trust that if you rang the call bell, someone will be there to answer? Or not being afraid that if you had fallen on the floor, there'll be no one be there for hours? Are you uncertain if anyone heard the bell? What if you injured yourself? Would you be bleeding to death on the floor and don't know if somebody is going to be there? These are some and many other issues faces our residents because of shorting staff. We come to the point where we need to start putting ourselves in the shoes of others. Our elderly deserves better. They've done the job. We are called heroes. However, we don't feel like we're treated as such. We feel underappreciated, disrespected, undervalued. I'm very honored industry. I do hope this report will not be brushed aside like all the others, and we continue as we have been until the next wake-up call, like a pandemic. Thank you very much. I only have a couple of minutes, but I have a lot to say. And what this government is doing from the federal to the provincial government over 20-something years is not being looked at. We're talking about COVID, we look at COVID. Oh, COVID didn't cause it. We cause it. We treat our elderly like garbage. We treat them like second-class citizens. They are not respected, they're not cared for, okay? Families put them in their home for us to take care of them. They put people in charge to take care of our care and take care of us as a Canadian. When I get old, I told my children, don't put me in long-term care. And I've been over 25 years. I'd rather die than going in a long-term care. If these things are not fixed, I will not be going into a long-term care because this is not a place for humans. 1.9% an hour. Who come up with 1.9 per hour for take care of person? Who come up with that? Would you do that to your parents? Thank you very much.
Thank you so much, June. And what you've captured is the fact that the people on the front line want to be able to care for our loved ones. They want to be able to provide the care. They simply can't. They don't have enough hours and they don't have enough staff. They want to do so much. And as Rebecca outlined, they are going above and beyond, not taking breaks, not taking lunch, not being paid for their work. And they shouldn't have to do that. And this is directly the fault of decisions made by both federal governments and provincial governments that have allowed this to happen. They've directly allowed this condition to happen. When you put profit in front of care, guess what happens? Care gets cut. If profit is more important than care, then hours get cut, staffing gets cut, quality of food gets cut, and our loved ones pay the price. That's what happens. The for-profit centers make profit, but our loved ones pay the price of that decision. And that is a decision that has been allowed by provincial and federal governments. And we're saying now, let us take some leadership at the federal level and push to remove profit from long-term care, starting with Rivera. Let's establish national standards that outline the minimum levels of staffing and hours required to give people respect and dignity. We can do this. Let's not let this pandemic and the crisis in long-term care just be a moment in time. Let's use the momentum we have now to push for change so that we can prevent this from happening again. And as June said, so that if someone has to make the decision to go into long-term care, it is not something they're afraid of. It's not something they're worried of. It's not something where they are worried that they're not going to be treated with dignity and respect. We want people to receive the best care possible, and we can do that. And the evidence is clear. We just need more hours of care. We need more staffing. We need to remove profit. It has to be about putting people first. It can't be about profit. And it's no surprise that the not-for-profit and the publicly run institutes are far better with staffing levels. Their goal isn't to make a profit, so they can put more into the staffing requirements. So we've got to do something about this. We have long been calling for change. We don't want to lose the momentum. Really honored to be here with Heather McPherson, our local member of parliament in Alberta, who's fighting hard for the entire province to make sure people know that we are there for you. We want to make sure that people are cared for. I thank you again to June and Rebecca. And with that, I pass the mic to Nina to take any questions we might have from the media.
Thank you very much. Merci beaucoup. Alors, j'inviterai les membres des médias d'utiliser la fonction lever la main pour poser vos questions. I would like to invite members of the media to please use the raise hand function to ask your question. Nous allons commencer avec Raymond Fillon avec TVA. C'est à vous.
Merci. Bonjour, M. Singh.
Bonjour, monsieur.
Est-ce que selon vous, il est temps pour le gouvernement fédéral de donner un échéancier pour la réouverture des frontières, la fin des mesures de quarantaine? Au même titre que le fédéral nous a déjà donné un calendrier pour la fin de certaines mesures sanitaires au Canada. Qu'est-ce que vous en pensez?
Je pense que toujours avec les décisions qu'on prend par rapport à les décisions d'ouvrir notre économie ou les frontières, c'est essentiel de suivre les conseils des experts de santé publique. Donc, on doit suivre le conseil et prendre les décisions qui sont dans l'avantage des Canadiens et Canadiennes. Ça, c'est primordial pour moi et on doit suivre les conseils. Pour moi, ce qui est aussi important, on sait qu'on doit avoir une vaccination de la population. Ça, c'est essentiel. Et quand on arrive à un moment où tout le monde au Canada est vacciné, donc je pense qu'on peut réfléchir, on peut à ce moment penser de comment on peut réouvrir notre économie et les frontières.
OK, donc il faudrait attendre que tous les Canadiens soient pleinement vaccinés avant de penser à rouvrir les frontières. C'est ce que je comprends de votre réponse. Corrigez-moi si je me trompe. Et je voulais aussi vous entendre sur les frais des banques. Vous en avez beaucoup parlé cette semaine. Qu'est-ce que vous pensez des réponses que vous avez eues du premier ministre au sujet des frais bancaires qui augmentent?
C'est absurde. Le fait que pendant une pandémie qui frappe fort à travers le monde, mais en particulier ici au Canada, que les banques ont décidé d'augmenter les frais de services. C'est incroyable. Et ce qui est encore pire, c'est le fait que le gouvernement libéral a le pouvoir de limiter les frais, d'arrêter cette mauvaise décision des banques. Le gouvernement libéral a complètement le pouvoir de limiter ça et ils ont effectivement laissé les banques d'escroquer les gens et c'est complètement inacceptable. Donc, on va encore continuer de dire clairement que Justin Trudeau et le ministre des Finances doivent déclarer que les banques ne peuvent pas augmenter les frais pendant une pandémie et qu'il doit utiliser les pouvoirs au niveau fédéral pour les arrêter tout de suite.
In English, please.
What is outrageous, the response of the Liberal government on this question is outrageous. But what is incomprehensible is how during a pandemic, banks that have been incredibly profitable, they've been making billions of dollars. People have suffered. Banks have made billions of dollars of profits, and we're seeing more and more evidence of their profits. That despite their profits, in a pandemic, they are increasing their service fees. How outrageous is that? What level of greed does it take for banks to increase their service charges when people are using more so their bank cards because they're being encouraged not to use cash? So banks are really gouging people. What's even worse is that the Liberal government has the power to stop them. Justin Trudeau has the power to stop them and is allowing them to do this. Justin Trudeau is allowing banks to gouge people in the middle of a pandemic. That is wrong, And so we're again saying Justin Trudeau, the finance minister, need to make it clear that they cannot increase, the banks cannot increase banking fees, and they need to use the federal powers we have to limit those fees and stop the gouging right now.
Catherine Lévesque avec la presse canadienne, c'est à vous.
Oui, merci beaucoup, Nina. I actually have a question for Heather McPherson. I wanted to ask you about C10, and because you're a member of the committee studying it right now, and so I wanted to have your perspective on maybe the timing of the study in committee, because we have less than 4 weeks left before MPs leave for the summer. So I was kind of wondering, do you think C10 could be adopted before the semester, the session ends?
Well, thank you for the question. It's a wonderful question, and one that unfortunately I'm not sure I have the answer for, because frankly it is out of my hands. We have a situation right now where the Liberals brought forward a very flawed piece of legislation. It's so important that we get a Broadcasting Act, that we do what we can to protect Canadian artists, Canadian content, the voices and stories of Canadians, but yet this legislation was so flawed and it was brought in so late that there has had to be a lot of work on it. Of course, the committee is still meeting. There's been an awful lot of delays. We are trying very hard to be the adults in the room on this one and get people moving and get people working on this legislation to improve it, to ensure that concerns around freedom of expression are addressed, that we make sure that at no point will Canadians' freedom of expression be compromised in any way, but that we are holding web giants to account. So I'm prepared to be at that committee just as often as I possibly can to get this work done, to get this clause by clause going forward. However, I'm not seeing that collaboration from the Conservative Party, and certainly the Liberals needed to do a better job with this bill to start with.
And so I know that the Bloc recently suggested that the House of Commons could maybe pass a motion or vote to urge the committee to finish the study of C10 in a given time. I was wondering if you would be ready to support such a vote or motion if it were to be presented.
Well, and it goes back again to the idea that, the Liberals have had a lot of time. They were a majority for 5 years, and then, they didn't even bring this legislation forward until late fall of last year. So they had an awful lot of time for us to get this legislation done. The fact that we are now in a crunch, that we are now heading into June, not having gotten the work done is not, this has to lie squarely on the shoulders of the Liberals. The Conservatives are filibustering in committee. There's not much we can do about that to prevent them from doing that. They are being very obstructionist. They clearly are not interested in making sure that we do get good broadcasting legislation. So in a lot of ways, we're being very propositional. We're bringing forward amendments. We do need to have the time to go through the amendments that have been proposed because of the flawed legislation. But hopefully, I'm optimistic that we can move forward. We do have another meeting tomorrow. We met 3 times during the constituency week, so we could continue to work. We've heard from experts. We've heard from ministers. I think it's time that we actually roll up our sleeves and finish this job.
Sorry, so just to be clear, you wouldn't support a time limit then?
We'd have to look at it. We would have to see what that means. There's no point in us supporting a time limit if what ends up happening with Bill C10 is that it ends up in the courts and no help gets to Canadian broadcasters for years to come. This has to be good legislation. So you need to make it right. You can't take shortcuts.
Merci beaucoup. Thank you very much. I'm just going to make one last call for media. If you have a question, to please use the raise hand function at the bottom of the page. Si vous avez une question, veuillez s'il vous plaît utiliser la fonction lever la main au bas de la page. Je ne vois plus de questions. I see no more questions. So this concludes our press conference. Ceci met fin à la conférence de presse. Merci beaucoup. Thank you.
Merci, and a big thank you again to June and Rebecca. Thanks so much for being here. Thanks, Heather.
Thank you, everyone.
Thank
Bye-bye.
you all. Bye.